Dissection of back of thigh. One horizontal incision is given at the junction of upper 1/4 and lower 3/4 of the thigh, and second horizontal incision is given at the junction of lower 1/4 and upper 3/4 of the thigh, and one longitudinal incision is given connecting both horizontal incision. Skin, superficial fascia along with the deep fascia of the thigh is reflected. Here are the muscles. Medially you will get this is semi-tendinosus. Below that this one is semi-membranosus, and this is the bicep femoris muscle. This is the long head and this one is the short head, and below that this is this one. This is the adductor magnus. Here is the sciatic nerve. This is sciatic nerve, and below that this is the upper one is the vein, and below that you will get the artery. This is the artery. This one, white one is the artery, and above this one is the vein.